Meanwhile, the crisis of this surge has triggered at hospitals across the country. It's also really taking hold in North Dakota. That state is down to just 8% of its ICU beds. And the shortage of frontline workers to care for those patients, that shortage is getting dire. It's so bad, in fact, the governor is now permitting workers who have tested positive for COVID to continue working if they're asymptomatic. I want to turn now to former White House physician, Dr. Jennifer Peña. Dr. Peña, let's start there in North Dakota. First of all, is it safe for healthcare workers to continue working after they've tested positive for the virus?
Good morning, Craig. Thank you for having me back. And of course, it is not safe. That is a terrible situation, but also it's a terrible way to have to address the situation. I mean, you don't deal with a burning fire by throwing more fuel at it. These places, our medical providers, our staff, our most valuable assets really right now in danger of developing worsening symptoms and endangering the lives of other healthcare workers and of patients, of course. And so in the absence of a national response, though, to the shortage of medical providers, the states and governors are going to have to ask for help. But that has to come from out-of-state volunteers, relax those licensing restrictions to allow out-of-state providers to join in the effort, like happened in New York City at the onset of all of this. And again, possibly deploy National Guard and federal assistance, like we just saw in El Paso with the Army. And I should say my heart is with El Paso. I was stationed there in the Army and served at William Beaumont Army Medical Center to understand that community and understand the disproportionate effect of that Latino community there. And so ultimately, the goal is to reduce numbers of cases and hospitalizations. And for this, we're going to have to consider those temporary lockdowns, stay-at-home orders, really abide by those so that we can bring down the number of cases.
A few hours ago, Dr. Fauci talked about the timeline for a vaccine. This is part of what he said.
Obviously, the first ones that are going to get it are people like healthcare providers who put themselves at risk. And then there are those who are highly vulnerable. We hope that by the time you get into the second quarter, end of April, early May, June, somewhere around that time, the ordinary citizen should be able to get it.
Does that timeline sound about right to you, Dr. Peña?
It does, based on the way that the Pfizer and some of the other vaccine developments are going on. Obviously, there's still some safety data that needs to come out, monitoring patients after that second dose for at least 28 days to see about any side effects. But I agree with Dr. Fauci. What's most important is these vaccines are going to allow us over time to develop the necessary herd immunity that we need to squelch this pandemic. But herd immunity requires herd responsibility. It cannot be done, without any method. It has to be done responsibly. And we still need to do our part to prevent the spread. We still need to wear our masks, social distance, hand wash. Just the CDC, of course, this week publishing that mask wear but can also confer protection to ourselves. And so we still have to do our part in addition to the expectation that these vaccines will be readily available to the population by sometime mid next year.
We've seen some encouraging vaccine news from Pfizer, as you mentioned this week, but there are some new concerns this morning about the potential side effects, Dr. Peña, with one doctor saying, quote, there are lots of sore arms and substantial numbers of people who feel crummy with headaches and muscle pain for a day or two. For a vaccine like the one from Pfizer specifically here that requires 2 doses close together, any concern that could keep folks from getting their second dose?
That's an excellent point, Craig, and it's something that we are challenged with vaccines in general, with the flu vaccine, shingles vaccine, for example, which does require 2 doses, and people sometimes get apprehensive about getting that second dose when they feel some malaise or some side effects after the first dose. So what's most important here is education. It's going to take a lot of education of the public to explain what to expect, really manage those expectations, but most importantly, try to explain the benefit, the ultimate benefit, even if it takes a little bit of side effect, management. the benefit will outweigh any of those risks. But it also, again, is going to require us convincing the American public of the safety of the vaccine, not just efficacy, but also safety. And so that's going to be our challenge as medical providers, to try to deliver that message and deliver it quickly.
Dr. Jennifer Peña, thanks as always, Dr. Peña. Appreciate you.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me, or click over on this list to see lots of other great videos.